Babak, welcome to the podcast. Do you mind giving us a quick rundown of your backgrounds and also what you guys
Absolutely.
do at Optain Health?
Sure. Alex, thank you for having me. So, my name is Babak, and I'm Business Development Director for Asia Pacific region at Optain Health, a company where we are on a mission to make healthcare, advanced and cutting edge healthcare, accessible to everybody. And that comes through a retinal screening software, AI based and powered, that screens retinal images and gives you a screening of whether or not you have three major eye diseases, being glaucoma, diabetic retinopathy, and age-related macular degeneration, AMD. But also on top of that, the software can analyze through the microvasculature of your eyes your overall cardiovascular health status, and the report comes out as an absolute risk over the next 10 years and your overall health status now. It's very, very cool, and I hope at some point I can actually show it to you.
Amazing, amazing. In terms of, so your role is mostly in business development and getting those partnerships and sales on board. So, in terms of that, I could imagine it's the sales process is quite an interesting one. So, how do you sell um, Optane, the product, and also, what stage is it at in terms of, so it's been around for a little while now and you're just starting to get customers on board now, or what does that look like?
We've been around for a while. The company came out of CERA, Central Eye Research Australia, a research project which was then commercialized in 2020. Not the best of timings. But then in 2023, we were spotted by an American joint venture, so Northwell Health, being a healthcare provider with 400 hospitals and clinics on the East Coast, bought through a joint venture 51% of our shares. Now we're kind of an American company, headquartered in the US in New York. And in terms of business development perspective and how we try to get commercial traction outside of Australia, it's all about, getting the technology in front of people for them to understand what we have also done. We don't just do a software. So we have a proprietary portable camera that we pair with this device to fully integrate the whole process into one very easy to operate and quick to generate process. What that means is traditional, say, retinal imaging through fundus cameras is you've got a big clunky device, and then someone fully trained has to sit on one side, you go on the other side, they take images, they then throw them into maybe a software to analyze, or an ophthalmologist will have to look at it. What we have managed to do right now is by basically pushing one button, a fully automated camera will take images, feed them into the integrated software, AI will analyze, your report will be ready all in less than 3 minutes, and you will know if you have if you're flagged by, say, any eye disease. The AI will also show you a heat map of the eye as to where in that eye it is seeing patterns consistent with its training on how to detect a certain disease. And then, of course, maps out the microvasculature of the eye and gives you an idea how healthy you are.
Nice,
Right, so that's the
nice.
product. So create and pushing all of this into new markets. Obviously, markets are different, so you have to be always on top of the nuances of the market dynamics when you're in business development. You know that very well, I'm sure. um, it all comes down to who does what in what market. The more advanced, if you can call it, the market is, like Australia, our optometrists are very well trained and capable of looking into a set of images and telling you what's going on. So in a market like that, or in Germany, where we're very, very active with really good commercial traction right now, it's an optometry game, right? You set your device up in optometry, people come in, it's an add value sort of service the optometry can generate. Um, because, for instance, in such markets, through referral pathways and whatnot, you don't get easy access to an ophthalmologist. We have 600 in Australia for 24.5 million people. You can never see one technically. Hopefully, you'll never need one. But then in, say, a market like Indonesia, where I'm at, or in Vietnam, it's a completely different sort of game. Hospitals are very much interested. There's a diabetes factor Anyone confirmed diabetic needs to have their eyes screened once a year at least for DR. And endocrinology wards are, we find out, that are very, very keen to get their hands on such device because their ophthalmology ward is very, very busy and inundated with a huge number of patients, high population, obviously. And so, what we are doing in terms of our commercial setup is to understand the market, find out those pathways, find the patient pathway, and then position yourself on that pathway so that you can create good access by empowering the end user, being hospital, eye clinic, maybe even optical store, for instance, here in Indonesia, and then pulling people in to give them that add value service. But then, of course, you will also need to look at, say, a cardiology hospital, because they can integrate that into their basic examination processes. Or yesterday, I had the pleasure of meeting the CEO of a health check organization. They do mass testing of people on many different sort of health check tests. And we actually agreed on deployment and working together, which would also be a very interesting sort of addition to the business. So opening up a new market is always about mapping patient and money flow, if you will, and finding that sweet spot that puts you right there in the middle of both so that you can add value to the user and the consumer or patient. So that's what we're doing and what we're mapping right now.
Amazing, amazing. It's definitely a more technical sale, as in you need that industry knowledge to be able to effectively sell it, right? I don't think you can
Absolutely.
really come from.
Absolutely. Yeah, look,
Hey guys.
any sales could be to a certain degree technical, right? It doesn't have to be AI or very technical. I used to do a lot of sales training in a previous job, and I used to always tell people, look, you have to come across when you sit in front of a customer as you know. Because if I sense or smell that you really don't, I'll lose my respect. That conversation is over. Even if we continue to talk, in my head that conversation is over. So yes, you need deep understanding of what you are doing, what your client is doing, and there are many different types, for instance, in our game, from an ophthalmology clinic to a cardiology hospital, and understand the nuances of their market and the service they provide. You have to be the one who connects all the dots for your customer. Make their life easy.
Exactly. In terms of sales, where did your career start in sales, and so how long have you been in the game for?
Uh, Over 20 years, or just about 20 years, maybe. It's very interesting. My first job, fresh out of uni, was basically to be the right arm to the general manager of a business company. A very young gentleman who, I mean, traditionally they had many different companies. And one day he called me into his office and said, "Hey, I need to ask you for a favor." I'm like, "Sure, tell." And he goes, "You know this other medical business that we just invested in like about a year ago?" "Yes." "And you've been helping them?" "Yeah." Um, it's not running really well. So there is a problem. So what I need to ask you is to move across from, we were doing fragrances and makeup, sort of cosmetics, right? And I was really passionate about that. And then he goes, "I need you to switch." So, "But I really like this." He goes, "Yeah, I know, but I need you to switch and take over basically sales and marketing there." I looked at him and said, "I've never sold anything in my life." And he said, "Look, I'm the kind of person who went to school and sold crap to my fellow students and friends. If you have any problems, you can always come to me. But I know and believe that you can do it and you'll be fine. But I'm here to help." It was that really belief that someone gives you for your first gig, really. And I think he was right. 20 years later, I'm still in sales, and I would like to think I've done a good job. And here we are. So, yes, that was the initial job. We relaunched that whole business We worked on a new launch sort of event, brought all the key people in, had a relaunch, and for the first 6 quarters, we were growing our business 25% quarter over quarter over quarter. It was an amazing success. It kind of got into my head at some point, uh, which then meant I had to go back to educating myself a little bit more. But overall, it was amazing, right? It was a great, great journey and success story, and I learned a lot. So that was that. And then pretty much from that point on, I stayed within healthcare and medical. It kind of fits better than cosmetics and fragrances, with all due respect to that industry, with my own sets of values and value hierarchy, if you will. So I'm here, 20 years on, still doing medical and keen to, sell something that makes a difference, to promote
100%.
something that changes people's lives for good, for the better.
Yeah, yeah, love it, love it. Yeah, I mean, it's a an industry where there's definitely some players that are only in it for the money and not really the patient outcomes, but there's also those really good ethical companies and salespeople that are selling the right thing to the right people that actually produces outcomes. In terms of
Absolutely.
if you were to start over in sales, what would you tell yourself,
Ah,
knowing what you know now?
very, very good question. A lot of different things. First of all, don't allow a success get into your head, right? There's always more. You should always shift the goalpost for yourself to always stay on your front foot, if you will, and then keep pushing yourself towards that next and next and next target. Um, Relationships, we're emotional beings, right? Focus on building lasting relationships. I have been really fortunate to have managed to do that, but at sort of earlier stages, because you're young and you're ambitious and you're excited, you tend to more focus on those short-term wins and goals and selling, while the long-term view, the long-term game is always the right game, right? So focus on relationships, focus on building those connections with the clients to always bring them back. It's been probably the one factor that I have over the last probably 10, 12 years done better at. And I can totally tell you that it has changed everything in terms of my record.
Yeah, amazing, amazing. It's
Be patient. I'll tell myself
totally.
to be patient.
Totally, yeah. Those long-lasting relationships, and they're the ones that bring you, all the results and something when you least expect it out of nowhere, rather than trying
That's
to
absolutely
just
right.
keep on selling and burning those relationships and
That is
only
absolutely
looking at the
right.
short term.
You're
I think
absolutely
a
right.
lot of
In all those sales trainings, we go through the sales process, this, that. But there's very little focus on, and we always, as part of the process, we've got established rapport. Yes, but
yep,
how, right?
yeah,
Nobody tells you really how.
yeah.
And established rapport there and then, or established rapport for a long game. These are two very different things that we need to be aware of and make sure we always focus on that long game.
So, having gone through, it sounds like you're highly educated in the sales realm. What have been some of the, I guess, the learnings out of that, and obviously your experience, but then also the education on that front? There's a lot of sales training out there teaching different methodologies, this method, that method, use this closing technique, and say this, objection handle. But it's all certain techniques that may work for someone or worked once. But what have you found as being kind of proven method in the sales process? Is there any kind of thought process or anything that you think about
Mm.
principle wise?
Um, we were talking just before the start about the pitch before the pitch, right? I truly believe in that. Doing your homework is probably one of the biggest aspects that changes everything. You need to know who you're talking to and what their motivations are, what drives them, what makes them tick. And every sales training sort of tells you that, right? But in that sort of going in with the right proposition for them to be able to for them to be willing to listen to you actually even further. Not, and when I'm talking about the pitch, I'm not talking about the sales pitch at all, because they have to give you the opportunity to deliver your sales pitch. And there is that establishing that sort of, it's like a game. You want to play with someone. You go and say, "Do you want to play?" And you want to convince them to play with you so that then you can take them through all of your process. Don't be focused on your own agenda. Find out what their agenda is and deliver your own pitch in line with their agenda. And then that should get you an extra minute of full attention and engagement to then be able to deliver your pitch. That is very, very important for me. I think that is one thing that I have relied on the most. I'll tell you a very interesting anecdote. Just a while ago, a very short time ago, I had to go into a meeting with a very, very successful, wealthy person as head of a company, and I'm going there to negotiate. And what are you going to say to someone like that, right? Extremely successful, extremely rich. Are you going to say, hey, partner with me and I'll make you a few extra bucks? He doesn't care, right? So, what I sort of thought of was, okay, let's go through this man's profile and find out what it is that he's really keen on. What's his purpose? What's his mission? And I actually found something. And I was like, okay, this is very interesting. And it aligns with my product that I am kind of pitching to him. So I opened up the conversation by saying, um, listen, our product, because on his profile he had a philanthropist. So all I said was, we don't consider ourselves just a medical company. We believe in our product having a philanthropic aspect to it. That was it. He said, can I have a look? Sure. I didn't even present. I had slides. I did not even get to presenting my slides. He said, I need to see this product. I showed him the product and he said, how can I be involved? Tell me. And that was our agreement. So and I was being very honest. Let me emphasize on this. There is no dishonesty in this. It was a very authentic, genuine thing because our product, like I described, this whole retinal imaging, it is a philanthropic product. We are on a mission to make cutting edge technology accessible to everybody, and that is what this amazing man is also on the journey of doing. And he later on told me some of the stuff he's doing. I had goosebumps. I'm not exaggerating. Amazing. So it was all about understanding what it is that you can align yourself with, their mission, your mission. If you can find a sweet spot, be authentic and genuine. People see through if you lie. Maybe not immediately, but later down the track. People are not dumb. So that was an amazing success, and I have an amazing partner in him as business partner, purely because we could align our missions, and it kind of was that simple. It's not always that simple, but if you do your homework, if you know that okay, this is the most effective way. It's not a trick. I would never call it a trick. It's a tip to make sure that everyone knows that there's a way of reaching, and if you manage that, you make the level do the rest.
Yeah, amazing. Yeah, I love that sales approach, and you have to always think about what drives the other person, and then aligning your product and what you do to that. And a
You're
lot of
100%
people
right.
miss that. A lot of people miss that. They sell the
Yeah.
features and they're hoping and praying that they'd be interested and that it somewhat how aligns. But I love your sales approach. It's certainly what a lot of people need to hear and need to actually implement.
Hopefully, I
It,
would love that. When I was training teams, I would always go, okay, look, after this training, I'm coming to the field with you. If you start by saying, I'm from such and such company and I'm here to talk to you about such and such product, I'll take over the call from you. And that's where you stop. Because nobody cares, right?
yeah,
Nobody cares. Ask a question. Or what I used to preach about then, if you can, if you're in a sales process of that kind in medical industry, you more often than not can, drop what I used to call snippet of wisdom, which is, hey, the other day I read a paper about the topic you want to basically talk to them about, and your product solves a problem for. And I read this. It was fascinating what they basically put through into that paper. What are your thoughts on that? See, I'm not selling you anything. I'm here to have your opinion on something that is your problem on a daily basis and you're dealing with. In that way, you have the opportunity to convey your opinion, convey your expertise and knowledge to me. And who doesn't want that? Who doesn't like and enjoy that, right? And you're showing genuine interest in your client in saying, I'm here to listen from you and learn from you. And when they open up talking, then you have the opportunity of going, and is that something you're dealing with right now? Is that a problem at your, say, hospital? Because I'm in medical business right now. And they open up and provide you with nuggets in terms of information and insight towards their pain points, just a buzzword, and issues that then you can go, what if I told you I can actually help you solve that? And at that point, they go, can you? Like, bear with me. So I think you said you have this problem and that problem. It would be ideal if you could have something to provide these add values or properties that could help you solve the problem. They would go, absolutely. Like, what if I had that? Would you be willing to have a look? They're not going to say no. That is when you provide yourself. I mean, you've already sold your product. That is your sales pitch. And then from that point on, you just convince them that this product does what you just promise. And, you know, in medical business, you always would go with a trial, with a pilot, you probably know. And then you put a pilot on. If you really believe in your product, if you're really selling a good product, the pilot should be successful. And from that point on, you've got a client.
Amazing. That's it just oozes confidence when you're talking about that, and it makes sense. You've already sold them on that, right? It's just a matter of showing them how it will do that and solve that problem.
Yes.
I love that.
Also,
I love
if
that.
you do that to me and say, hey, you just said you have a problem. Yes. You said this and that will help your problem. Yes. I have that. Do you want to have a look at it? Can I even say no? I'll come across inconsistent and mad. Who
Exactly.
wants to portray themselves like that, right?
Yep. Yep. 100%. That's sales psychology there. We want to be consistent.
Yeah,
Um,
absolutely.
uh,
I'm
yeah.
super interested in psychology as well. So,
Interesting. What about so obviously sales and psychology, right? Like sales is psychology at the
yes,
end of the day, right?
it
It's
is.
what are some of the, I guess, psychology, right? And relating that to sales. What are some of, let's start with, I guess, the education and the principles, right? Has that come from books or has it come from formal education or?
Formal education, then on the job trainings, you know, every 6 months you have a sales and marketing event, and you normally have a speaker who comes in and talks about those things, sometimes based on where you're at in your trajectory towards your target that year. If the executive management think you need an extra push, a sales trainer comes in, you know, all of your Dale Carnegies and this and that, you know, all these methodologies, which are all great. But what I, based on my personal experience, have come to is understand all of these and utilize them, but have this ability and hopefully the agility of mind to sit in the process and be able to pull through from a few of them at the same time, depending on what's going on. So, coming to the psychology aspect, always ask questions, right? Genuine and authentic and from a position of curiosity, because that is when you get the information. You have your own agenda, yes, but they don't. Their agenda at that point in time may not align with yours. I have been in a sales meeting where the salesperson is talking about, oh, this and that and that. We're selling dressings, right? And the client is constantly saying, my problem right now is infections. I have a lot of infected wounds. What do I do? And then my salesperson is continuing on their own patient. At that point, stop, right? Tell us more about those infected wounds. What is the problem? Let's see if we can do something for that. Let us drop our agenda. Let us listen to you. So asking those questions obviously allows them to trust. that you are there to understand, you are curious, and you want to do something good for them. And in that process, then you will be able to, like I said, get those nuggets of information that are gold, absolute gold, and then you position yourself and your product or your pitch towards those little insights. Ask questions. The psychology will come out there. They will tell you um, what they want, what they're after, what is giving them headache right now in the job they're at. And from that point on, you're a trusted partner. You're someone who listened to them, right? And we love good listeners. We all do. You're being a great listener, by the way. So,
Thank you.
thank you. So that's why I'm going nonstop. And that's where you come to that sort of aspect of, okay, psychologically, now we are aligned because we are on the same wavelength. You're dealing with you, and we know when two people feel the same thing, the same parts of their brain sort of align and go on the same wavelength. Once you're there, once that alignment is there, you have the right, you have earned the right to say.
Completely. I love your sales approach, Babak, and
Thank you.
the confidence about you is quite evident, right? I think in terms of sales, that's confidence is, I think it's the most important thing, right?
Oh, yes. Oh,
Confidence
absolutely.
in what you're selling. And so I think if you
Absolutely.
can, same skill, someone with confidence, someone without confidence, someone with confidence is going to outperform them 10x. Like, it's,
Absolutely.
it's unbelievable.
On
So,
anything, on
yeah,
all levels and aspects of life, right?
yes,
That's something that I always used to tell people, like, fake it. If you don't have it, fake it till you make it.
yeah,
It applies here. With confidence, it absolutely applies. You're not being dishonest or anything. And I think there are two aspects to that confidence, one in yourself, one in what you're doing. So finding something that your hierarchy of values aligns with allows you to have that confidence in what you're doing. So I believe in my product. I believe in the mission I'm on. So that creates that degree of confidence. And then you have your own, put them together, you're 10x it versus anybody, as you said.
100%, 100%. So in terms of where you're at currently and where Optain is looking to grow, what does the next 12 months look like for you guys?
The next 12 months is going to be very, very interesting, very exciting, a lot of pressure. But a very well-known tennis player, a tennis legend once said pressure is privilege, right? I truly believe in that. Um, we just are finalizing a fundraise process. So as part of that fundraise now, all eyes on us, especially for commercial traction, to get our product out there and get it into the hands of the right people, make a difference, commercial traction. So the next 12 months would be probably very little of me seeing inside of my home uh, and parking myself, for instance, in APAC region, working with our partners in the region to establish the business that we have identified together. We have identified the avenues of opportunity and set action plans for each sort of channel or segment and then execute. So for the next 12 months, we'll be executing a little bit of planning and then boom, 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 execute, execute, execute. The important thing in the kind of game we're in, where we work with distributors, is identify the right partners who are capable, who have the capacity, and empower them to go. But you have to be there with them. It's a great sign of basically partnership, but also you are know things that can help them convey the message right, but also you will learn things that you will bring back and fine tune your core messaging and then take it back to them. They can push it even better in their own market based on their own dynamics and nuances. So yes, it's all about execution the next 12 months. It's about living on the road and getting the sales going because we're here to put our product in the hands of everybody who needs it. We're going to do that.
Amazing. Amazing, Babak. Look, it's been a pleasure speaking to you today. I know we're running out
Likewise,
of time, and I think we can definitely have a part two to this maybe later on in the year, and we can keep
would
on
love
chatting.
that. Would
But
absolutely
yeah,
love that.
amazing to speak
Thank you
with you
very much.
today,
Great
and
conversation. Thank you for the invite and having me. And yes, why not? Let's have another follow-up in 6 months.
yeah, my pleasure.
I hope I'll
Thanks,
have some
Babak.
good updates. Thank you.
Thank you.